Welcome back. You are watching Breakfast Television. Time now 7:30. To COVID-19 now. We are seeing an increase in hospitalizations. In fact, looking at some of the numbers, almost 12% climb just in the last week. And this is in the middle of this sixth wave. So where are we? Will things get better? Will things get worse? A lot of questions here. Joining me now, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Good morning to you.
Oh, good morning, Mel.
I want to begin at where we are right now in this wave. The numbers are showing that we have peaked. Are you seeing that exact same data? Where do we go from here?
Yeah, we may have peaked in the wastewater signal and in total number of cases last week. But there's a ripple effect as the virus makes its way through the community. We anticipate hospitalizations and people having to be in the intensive care unit peaking in the next week as well. And thank all of our healthcare workers who continue to take care of these individuals. So we have another rough week ahead of us. Monitoring the situation closely on a day-by-day basis. Can never underestimate this virus. So I ask all Ontarians to remain cautious because this virus is in all of our communities.
When we look at the hospitalizations and hearing from a number of our health professionals who are on the front line, it's frustrating. If we were to go back, and hindsight, but if we were to go back to just after March break and when some of the mask mandate was lifted in various settings, including schools, knowing what we know now and looking at the numbers and seeing that ripple effect, would you have recommended lifting it?
I wouldn't go back because children aren't the individuals that are causing the increase in hospitalization. It continues to be our elder members of our community. So the key message to those individuals is please come forward, get your booster dose, either your first booster or your second. So I'm happy to say 75% of Ontarians have gotten their, that are 50 and over have gotten their first booster. 25% of those that are 80 and older have gotten their second booster. But we all need to stay up to date with our immunization if we're going to be protected against the severe outcomes, which is what all Ontarians want to be protected against. And the vaccines are our biggest and best response to that threat of hospitalization. So please come forward, know if you're eligible for your first or second booster. As well, I'm happy to say over 8,000 doses publicly funded treatments for outpatient therapy for COVID with a drug called Paxlovid have been dispensed across Ontario through great partnerships with our pharmacies, with our primary care providers. So roughly 570 treatments a day are getting prescribed. So stay up to date with your vaccinations. As well, know if you're eligible for this outpatient therapy because it too can prevent you from being hospitalized. It can stop the virus from getting into your cells and keep you out of hospital. And we've got plenty of that treatment available across Ontario. So two great options for Ontarians. Stay up to date with your vaccines. Please also know if you're eligible for Paxlovid. And we'll be also releasing another tool in our toolbox called Evusheld, which will be a treatment to protect individuals. And this medication can be injected and prevent for over 6 months someone coming down with severe COVID. And particularly that will be made available to those that are transplant patients and or those with blood cancers. So that treatment should be available this week in Ontario as well.
This week, where will it be made available, Dr. Moore?
It'll be made available through most of the transplant centers as well as cancer centers. So all of that detail is getting worked out this week. We're working with our federal partners to ensure we get the product shipped to Ontario and then dispensed across the high-risk centers like transplant centers and cancer centers.
I just want to go backward, Dr. Moore, to clarify what you were noting there. I mentioned the school setting and then the masking being removed, but of course we have a number of adults in those school settings. And is it not fair to say that some of the spread might have potentially come from schools to spread to some family members and then throughout the community?
So you're clearly saying that we need to continue the layers of protection. So I ask every parent and child to screen every day, to make use of the RAT test. So we're dispensing around 16 million tests every week across Ontario. Those are very important tools. Stay up to date with your immunizations. We continue to provide masks in schools, so high-grade masks for students, as well as non-fitted but N95 masks to all workers in that environment. We absolutely are mask friendly and support those that want to wear masks in that environment. And I absolutely encourage individuals to continue to wear masks. We're not through this yet. We're past having a legally mandate for those settings. We do, though, have mandates for the highest risk settings, like our long-term care facilities, our retirement homes, our treatment centers, any clinical intervention or interface with a healthcare provider, you must be masked, as well as on public transit. So we are maintaining masking as well. If you've recovered from COVID, day 6 to day 10, you should continue to be masked. As well, if you're a high-risk contact, you should be masked. So we're embracing masking as a prevention strategy for all of those environments, especially those that are high risk.
Dr. Moore, we've run out of time, but I do want to get your take on this. New Canadian modeling research has come out, and it's suggesting those who are unvaccinated against COVID-19 are putting themselves at a greater risk of infecting those who are vaccinated. I'm sure you've looked at some of this research. Before we let you go, I want to get your take on what this all means and how you interpret all of it.
Well, I would say I'm not aware of the details of that study, but unvaccinated, it would make sense that they could shed more virus for a longer period of time and be more infectious. That makes sense to me, and absolutely want that 8% of our population to come forward to be vaccinated, and or to know that you're also eligible for treatments now that can decrease the amount of virus in your system and prevent you from being hospitalized. So 2 good interventions that we need all Ontarians to be aware of.
Okay, Dr. Kieran Moore, I appreciate you taking the time with us today. Thank you.
Thanks, Mel.